Welcome, everyone, to Clambake. My name is Lisa Carnival. I'm the co-founder and executive director of Design by Rhode Island. Welcome to our monthly gathering for design enthusiasts, Clambake. How many have been to Clambake before? Or have not? Sorry. All right, awesome. A few new people. So Clambake is our monthly gathering. We bring two designers together to speak, usually from different sides of the design discipline. And this year we've been on tour with our location. So we're psyched that we get to go out and explore different places and find out what else is going on out in the Rhode Island world. Tonight we're here at Wilbury Theater. Next month we'll be at Jamestown Art Center. So we do leave Providence. You can come with us. We like to go out and explore. So what you'll hear tonight is from the two speakers. They're 15 minutes each with Q&A after their talk. So gear up your questions and sort of think about it. For those of you that don't really know too much about Design by Rhode Island, we are a nonprofit organization working to elevate and strengthen and help the Rhode Island design sector thrive. So that means working with designers and design businesses and trying to raise awareness of the work that's here and their talent and what they do, and also invest in them with workforce development and training and mentorship, some grant funding in a particular program that we have. And then one of our major events is Design Week, which is happening in September. So this year it is 10 days, sometimes it's 11 days, of activities throughout the state that really highlight the design talent that's here. So definitely save the dates for September, and there's postcards at the end. Our first speaker is Ben Grace. Ben is a designer and creative technologist whose passion for merging traditional design with digital technology creates new modes of content and experience. With training in architecture and graphic design, Ben co-founded Ambo Studios, a technology-driven experiential design studio working at the intersection of design, digital, and physical experience. Please join me in welcoming Ben.
Hello. So my name's Ben, and I'm here because I co-founded Ambo Studios about 2 years ago, and Lisa did a pretty good introduction. So here's some photos of our work. So we've done projects that range from music festival installations to fashion shows and runways. A lot of our work combines lots of different types of media, and we're kind of practicing within the realms of kind of temporary architecture installation, projection mapping, and motion graphics, but then creating and developing sort of these interactive experiences. And so a lot of our work is to sort of excite and engage and create these sort of moments of inspiration and awe. And it's about bringing people together for these shared collective experiences. And so this is kind of this is an example of some of our fabrication work that we've done. So we'll do everything from sort of interface design, making sort of new modes of experience for that, as well as sort of temporary architecture pieces and structures. We'll also make interactive systems, whether that's using your body to sort of drive a system, or these cool kind of physical devices that change the environment around you with the work that we've made. And then we'll also make visual content. So this ranges from sort of ephemeral, more passive motion graphics to real-time interactive simulations and processes that you put an input, like your physical input into it, and it's responding in real time. So that's kind of how you would break down. So kind of one of my favorite quotes is from Leonardo da Vinci is, "To develop a complete mind, study the art of science, the science of art. Learn how to see, realize that everything connects to everything else." And I think this is one of those quotes that just always stuck with me. I mean, it's from Leonardo da Vinci, so it's going to leave an impact. But it's kind of given me the sort of excuse to go after all these different things that I'm interested in and then see where those connect to create new things. And that's really what we're trying to do at Ambo Studios, is to see where things start to begin to overlap by being invested in these different technical processes. But anyway, so for me, my design journey started here at Mississippi State. You can go to the next. But really, it's cut off. But our architecture building was directly across the street from the football stadium, which made it, kind of annoying some days to practice architecture. But for me, that's where my foundations come from, is from being in this sort of counterculture or culture that's not very design conducive, but being surrounded by these very passionate, like other architecture students. And for me, was my kind of escape and place where I got my foundations. And so initially, when I started architecture school, I was drawn to the sort of phenomenological architects, the architects who are all about creating sensory experiences, using form, material, light to create these beautiful sort of sensory works. But they also, this is architecture. These had to function and provide roles. And so I think a great example of that is the Kimball Art Museum in Dallas, Texas, which I've been to like 3 or 4 times. It's this beautiful, he did this sort of arch. It's a gallery, so you can't have any direct light actually hitting any of the sculptures. So he made this kind of seam down the center of these arches. And it's this beautiful, all he's doing is taking light and concrete and making this beautiful sort of, it's almost like a waterfall of light around the space, and it kind of pulls you through each gallery. And for me, this was just kind of something I always wanted to recreate, and was wondering, how do you take something so simple and such elegant forms and create this experience that you're kind of conscious of it while you're in the space. So this is more examples of some of this work. And I think another aspect that I was kind of latched onto is Baroque and Renaissance architecture. And I think seeing these types of works is very hard in today's age to really understand what they were doing or to have fresh eyes. But in a time when you only saw the same amount of imagery in a day that we do in a year for people at this time, it's just this crazy. I just wish I could go back in time and understand what the power and the sort of impact that these sorts of work had. But I think it was also this blending between painting, sculpture, architecture, design, all came together, and these disciplines started to blur. And when I kind of came across this work, I'd always tell people, I want to make this for today's age. I don't know what that's going to be, but I just loved the way that this work came across. And so kind of as I graduated college, I reconnected with one of my good high school friends, and we founded Ambo Studios. We kind of saw an opportunity to create experiential work, merging our different passions and skill sets to create these interactive experiences. So this project was our first project, titled Oasis. It's a kind of temporary pop-up amphitheater and an interactive space on its own. And this was pitched to music festivals and these sort of bigger live event pieces. And so the form itself is basically just a circle, and then if you're to take that in plan view, cut that in half, and those arcs are then rotated around. That's pretty much the form. And then we kind of carved out an oculus in the center to kind of draw people in. And so the form, it's very kind of reminiscent of more classical architecture in some ways. We kind of made an abstraction of a pendentive in a lot of ways. And the oculus was something that I've always been kind of fascinated with. And we incorporated this into the design for practical reasons, as well as to sort of be the sort of central location point. We were pitching this to music festivals, and we really wanted to create a space that could hold lots of different people, but avoid making another big tent at a place that's filled with tents. And so it's to sort of carve the center out allowed us to make a very light, portable structure. And sort of the way that there's a gap in between the two back projection wings, we did that so we could do we avoided more complicated projection mapping, and we were able to sort of set this thing up within an hour and a half. And another kind of classical reference is the architect Bernini when he was coming up with his ideas for the form of the Vatican colonnades. He used this analogy of a sort of human holding and inviting people into the space. And I think this space was trying to do a very similar sort of thing, where it's inviting and it calls people into it. And we wanted it so you could kind of see the projection mapping and the content on it without actually having to be inside the space. Yet this sort of Oculus became this kind of magnet that you would go into. And so for the content, we wanted to create a space that was more ethereal, serene, kind of as if you were in the sort of forest, a way to escape from the sort of hecticness of a jam-packed music festival, kind of an oasis. I guess that's kind of where the corny name came from in some ways. But we used microscopic imagery, scaled up like I believe it's 300 times, and we just filmed very simple things like soap bubbles, film, like liquids, and we videotaped that, and that was what the content you were looking at. And when you see that work at a scale that's 25 feet long, it becomes this sort of otherworldly experience in some ways. And so I think overall it was very interesting to see how people reacted to it, because going from the architecture school where you're building scale models and imagining how people will interact with the space, and then going to a project where you're actually affecting and seeing how people want to interact with the space was very gratifying. And the fact that although there's this Oculus that is framing essentially space like air, which is all around the space, you want to be inside. And there were times when there were 25, 30 people all just kind of dancing within the center of the space, and it was a lot of fun to see. And I think where this project worked. To kind of go back to the point of using very simple things like framing open air, using everyday liquids, but turning them into these moments that kind of stick with you and you want to remember, is this quote by G.K. Chesterton. He was a English philosopher and writer. The function of imagination is not to make the strange things settled, as so much to make the settled things strange, not to make wonders facts, but facts wonders. And I think that goes to like the world around us is already beautiful and crazy enough. It's kind of the role as a designer to highlight those moments and make people sort of conscious and aware during these processes. And for me, one of the sort of hallmark examples of this is the Eames, and in particular their Powers of 10 videos. And for those who are unfamiliar with it, they start at the human scale and take you through time and space by going every 10 seconds. It's 10 times as far away as it was and as close as it was. And during this process, they're really telling you what we already know, that the world is really big and that the world is really small. But they're framing it in a way that starts out with the human scale, and you begin to sort of feel what is actually around you, not just understand it from like a scientific level. It's you begin to empathize with the information. That's a sort of way of taking an experience and turning it into like an educational moment, which we ended up doing a similar thing for another project we did. This was for Better World by Design, a Brown student-led design conference. And so they had this sort of hallmark event towards the end where they weren't really sure what they wanted, but they wanted something to sort of tie the whole event and experience together. And we pitched them this sort of user interface that not only made for a fun, eventful night, but it taught it connected all the conference together. So we made a way for you to learn about the speakers at the conference and the sort of overall theme in a playful, fun way that not only like one person or a couple people could play with, but then it was projected across the whole space. So it became this sort of centralized piece. And this is the actual interface of it. And it was through a touchscreen, and you were able to sort of cycle between the different content. And so this looks like a graphical interface, but we actually used a video game engine to make this. And the reason why we did that is we wanted to be able to program, I think it was around 50 different speakers, and to take advantage of the sort of real-time graphics content. So all of the sort of imagery that you're seeing is actually 3D objects in like a virtual space. And the same mechanics that how a video game uses a gun to sort of know where you're aiming and to hit a target, we use those same mechanics so that when a person was able to like look at all the different speakers, you were able to touch and it knew where that would be. And the sort of fluid simulation, that is something that we chose because we wanted to sort of ground this very digital interaction with a more sort of natural sort of feel. And it was also a lot of fun, and there were these different buttons and triggers that would affect what was going on in the system. So it became, or when one person was trying to play with it, somebody else would sort of press a button and it would all explode, and it became this playful, fun sort of thing that you would have one person kind of explain this, and people sort of learned how the system worked as the night progressed, but also learned who the speakers were, what times they were talking, these different. I guess to kind of go back to the beginning, so we're working in a lot of different disciplines, and this is sort of a way that I've been looking at the way that we work. So we have like my foundation, the main sort of branching system would be the design process, then breaking into the different disciplines that we practice. Then for us, it's helpful to look at the actual programs or specific processes that are involved, and then what within those processes, those specific skills enable those processes to come about. And for us, this has been really helpful because there are similarities between these different branches, and a lot of it sort of comes from those basic foundations, but our projects themselves come from not just kind of one area, but how do these different areas that we're interested in begin to sort of network and weave an experience. And so that's what we're doing at AMBO.
So, are you doing all these projects as like independent contract work? Do you developing? Do you eventually license or what?
Primarily, it's event-based work, but we are working on projects where we develop more of like a fabrication type, but sort of a network of these things that then could be that we wouldn't necessarily have to be there for each project. It's been primarily event-based and sort of.
What's the timeline then for AMBO Studios? Like when did you first open it?
So we first opened it a little over 2 years.
How difficult was it to find somebody to make that structure for you?
We built that ourselves.
You built it yourself?
Mm-hmm.
So you're not selling to me?
Yeah, so the fabric, it's actually the spandex that's really stretchable. So the actual metal of the structure is conduit that we like bent, and then we use like PVC that was ripped in half to sort of hold the fabric, so the diameters would kind of latch onto it. So that's the way that we did the rear projection of the project.
How did it take?
It took like 2.5, 3 months of kind of more trial and error and figure out what's like the best process to use.
How did you protect the projector from like the music?
We put it so it was behind, so people weren't really walking behind, but we had it in sort of just like a plastic box basically for when if it would rain and then the cords were like covered.
What's a typical project development time? Maybe hours?
Hours? I'm not sure on hours because we're kind of, for some of these it's like everything, but like for the better robot design we had 3 months heads up. For some of them we've had kind of 2 weeks, and so that's where we, like a lot of our practice when we're not hired or have a project coming up, we're experimenting in these processes. And then when somebody does and they have a need, we kind of have something hopefully kind of pre-made already that we're able to sort of reskin.
How big is your team?
It's
How do you find projects?
So some of that's just good old kind of like reaching out, networking, and we've been working with a couple bigger companies in Boston that do more event-based work, so we've been in some of their pitches. And then we have an agent in New York who will throw us kind of stuff that they have a sort of network of kind of event-based. It's more artist in some ways, but that's kind of that sort of side of it. So we're kind of have a couple different like things going.
In what area are you eager to expand?
I think the possibility of using video game engines, because you're not like, I feel like today's age, and especially younger kids, and as technology keeps developing, we want things to be interactive, and that's, I think, the future of storytelling and experience. And with kind of harnessing the visual capability and then the scalability of a video game engine is what's kind of exciting the most, paired with sort of how do you put that in space?
So your background is architecture. What is your partner's background?
His is in product design.
Is what?
Product design.
Just a technical question, what projection mapping software do you use?
So we'll use a program called Touch Designer.
Oh, okay.
Yeah. And then Arena for more like DJing sort of works. So, yeah, primarily Touch Designer.
Thank you, Ben. That was awesome. So our next speaker, might also say that if anyone, I think a couple of you were with us at the Designers Ball this year, our inaugural event in February, and Ambo Studios had an amazing piece of that and a projected kind of experience. So we're psyched to have them as part of that as well. Our next speaker is Hannah Chung. Hannah is the co-founder and Chief Creative Officer of Sproutel, an award-winning research and development workshop that creates meaningful products in play-based healthcare education. In 2015, the White House and the then President Barack Obama recognized Sproutel as one of 32 companies representing diversity in tech, and in 2014 recognized Hannah as one of 50 honored makers. We're very excited to have Hannah join us.
Hi everyone, I'm super excited to chat about what we have been up to. I'm usually in behind with the Clambake committee members, finding speakers and, launch the event together, but it's kind of fairly exciting to be on the opposite side of sharing a story. But today, we have been in Providence for 6.5 years. It's been a really long time. Some of our team members, my co-founder Aaron, and newly joined Sproutelian Nick is here. And excited to share what we have been up to in this past 6.5 years. And we also just moved to our new bigger office at the plant, so it's been a really exciting new years happening at Sproutel. But who we are is we are a patient-centered research and development workshop. And what we do is we create products that makes meaningful life impact in the patients' lives. What we do is we don't start with a solution, we start with a problem. So what we do is we talk to patients, we talk to families, kids, doctors, experts in different fields in robotics and design to understand, what is the biggest problem that these patients go through. And, with our team of engineers, designers, game developers, production masters, and all these people that we are an 8-people team. We try to understand that and really root it into the patient, understand them with empathy, and think about what's the best way that we can deliver something meaningful to them in their lives. Because we're not going to solve the grandiose problem of health, but there's a little small area that we can create impact in the areas that we can really do. And what we have seen is, in creating something that helps people to give comfort is an area that we have been doing very well and excited to explore more. As Lisa mentioned, our work has been featured in a lot of different places. This is a picture of Aaron and I at the White House with our first product, Jerry the Bear. Jerry wishing happy birthday to then President Barack Obama. It was pretty cool. Currently, in our portfolio, we have two products. One is Jerry the Bear, which is a cuddly, interactive teddy bear with type 1 diabetes, where kids can take care of Jerry to learn how to manage their type 1 diabetes and also read a host of really interactive storybooks on learning how to apply their type 1 diabetes lessons in the social situations. And the next one is our second product called My Special Affleck Duck, where we collaborate with corporate partners to help them tell a very powerful brand stories in their different philanthropies. So this, in this case, has been focused on children with cancer. So it's been a whirlwind of really exciting year and a half working on this robotic duck. And it's a duck over here, a little friend. And that's the story that I'm going to tell more about. But before we go into that, I would love to kind of share why we started and how Sproutel came to be, because those are kind of important backgrounds that kind of leads to why we have been working on the Affleck Duck and how we have done that so far. So back in the day, when I was young, like I was 12 at that time, or 14, that's my sister, Cece. And, it was, we are a happy bunch, but a big event happened in our family, which is my dad got diagnosed with type 2 diabetes. My dad wasn't obese. Both of my grandparents have type 2, so I assume it's genetics that he has gotten this condition. And it was a really big change for us. My dad was very embarrassed to talk about type 2 diabetes. He, was very secretive about his management, and he was very angry and just not happy going through those times. And what we have done is my dad needed to really change his diet and the way he monitors type 2 diabetes, but he felt very alone. So what we did as a family is we changed our diets too, so that my dad is not the only one going through this process. So we were eating low-carb diets. There are some times my sister and I will check our blood sugar level with my dad to make sure that, oh, this is like very normal. Like, why are you really scared about this? And in the 2 months' time, my dad lost a lot of weight, and his blood sugar levels were coming in the normal range all the time. And the whole time as a child, what I've learned is that, having these chronic conditions can be very isolating, is very stressful. But when you build a community around a family member or anyone who is going through this condition, you can feel empowered, and there's a lot of joy and support that comes from it. And from this experience, I was very interested in health as a topic. But as any teenagers going to college, I was thinking, how can I get there to work on health? Because I'm very interested in art and science. I'm also very interested in art. How can I combine those two together? So actually, I went to college to study engineering, and I still kind of continue to have this challenge of how can I still combine these two together? In my freshman year in college, I was very fortunate to meet a group of really amazing people to launch this nonprofit called Design for America, which is a national nonprofit with many college students in their studios working on projects that creates social impact or have those themes and using design thinking. And this organization was really important for me because this is where I met my co-founder, Aaron. And Aaron and I, we were looking for projects, and we were learning design thinking as an extracurricular activity. And the way we learned design thinking and human-centered design came very organically. And it was really through our first project called Jerry the Bear. Jerry the Bear what started out with a problem statement called, which was, how might we improve the lives of kids diagnosed with type 1 diabetes? It was really broad initially. How can you help people living with type 1 diabetes? And what we have done is we went to the users to really observe what are the things that people with type 1 diabetes are going through. We went to the hospitals, we talked to patients, and what we have realized is that kids with type 1 diabetes are very neglected. And what we have learned is that kids are diagnosed as young as 18 months old. They prick their fingers multiple times a day, take insulin shots multiple times a day. So, as you can imagine, kids taking shots is a very, very scary experience. But, these kids have never known the life with type 1 diabetes before. It's a big change in their lives. And a lot of times, because this condition, there's only 18,000 kids newly diagnosed with type 1 diabetes every year, usually you're the only one with type 1 diabetes in your school or even your nursery. So kids have a difficult time talking about their conditions. And similar to what my dad was going through, it's very isolating and kids are very embarrassed to talk about this condition. But when Erin and I went into the homes and observing how kids are coping with these conditions at their home, we have seen that, like all kids, they have their favorite stuffed animal or a teddy bear. And they were actually pricking their stuffed animal as if they have type 1 diabetes, or giving a picture, stapling a picture of an insulin pump and mimicking what they're going through with the stuffed animal. And we thought, this type of imaginative play or mirroring play exists. How can you make this real? How can you make this more, how can you contextualize this to fit well with the kids with type 1 diabetes? We started out with a prototype that didn't work. But as we're testing with our first child, we have learned that kids are very honest about giving feedback. And even though this prototype didn't work, our first prototype, what this proved was this child that we were testing with, this child was waiting for 3 weeks to see the concept of a type 1 diabetic bear. And what we have realized is that maybe the prototype didn't work, but the idea is there. Let's keep making it more and more. So that was around our early junior year. And throughout, Erin and I started making our independent studies to continue working on Jerry the Bear, because we have found that we're spending way more time as in our extracurricular project than our actual coursework. So we decided to kind of combine those together. And along the way, got a lot of small grants to big grants. One of the bigger grants brought us to Providence to actually go through a workshop at Brown University, and met a lot of mentors who actually believed in us as a company to launch this than a just cute college students working on a teddy bear project. So we moved to Providence 6.5 years ago. I went through an incubator, but our journey was, as we are working at our company full time and taking our classes remotely, we wanted to put 100% of our time and efforts into creating this bear. Along the way, we have built about 29 different prototypes and tested with about 350 kids, created this new methods, like earlier, how we were wearing the bear suits to test best with children to really build the connections quickly. And in the Christmas of 2013, we launched our first Jerry, which had sensors swung around, and kids are actually squeezing Jerry's fingers to check the blood sugar level. And we started out with building 250 bears, really handmade, to upping that to 500 the next year. And what we have learned is that this bear, when kids are using this, we are seeing all this impact we wanted to hear. Kids are no longer shy about talking about their type 1 diabetes. Siblings want to play with Jerry too. But as a business, because type 1 diabetes is so niche, even though we have a host of awesome impact stories coming in, it was not enough revenue coming back to really sustain our company or even do more work in different conditions for us to do. So after the launch of our first products, it took us some time to figure out the right business model, to really figure out what works for Sproutel for us to do good work, but also expand our expertise to build more products to help other kids in those conditions. Along the way, we have gotten a huge grant from the National Institute of Health through our the Small Business Innovation Research Grant to do some kind of feasibility studies for Jerry. And what we have seen is since 2013 to now, a big shift in diabetes technologies has happened. So now kids use this product called continuous glucose monitor, which is a device that you put it onto your skin and just continuously measures your blood glucose level. And this is now paired with a smartphone. So what happened was in 2012 and 13, not all kids had smartphones, so we actually hand-built our custom-made Android tablet to put it onto the Jerry the Bear belly. But now all kids have smartphones, so we thought to ourselves, what if we move all the technology that we have built for Jerry into our smartphone and really use this technology? And also, how can you build a physical Jerry to be more affordable so that we can make a bear that do all the functions that we know it works, but is affordable, and we can do a lot more by using the smartphone. So we have made a shift earlier last year, and we launched this. And we have seen that all kids still really enjoy using Jerry. And what we have done with the smartphone is that by adding this special patches on Jerry's injection sites, you can scan those patches with the phone using augmented reality, and it will pull up different diabetes schools that you can learn. So it's actually more tangible and hands-on. And what we have seen is that we expanded our reach from being only United States to global, so that most recently New Zealand created a program and they've successfully fundraised so that all children in New Zealand with type 1 diabetes will have a Jerry the Bear. And the business model that really proved this work is that before we have sold our bears direct to consumer, by switching the business to business model, we're now working with two nonprofits who have a biggest reach. So they are buying the bears bulk from us and they're distributing. And when those two missions are aligned, not only you're creating the impact and reaching the numbers of helping children, it also gives us enough revenue to expand our work and really, even expand our product line and also work on new projects. Along the way, so this is our 6-year mark of working on this. We have been around for a long time. People now look at us as experts who really figured out, like being in the niche market typically and helping kids. How do you do your work really well? And the Jerry story has been kind of word of mouth transferred to other people to learn about this. And along the way, Aflac, the insurance company, have learned about our product. We have also met some cool mentors in different competitions that we have entered. And they had this huge problem where they have this Aflac Childhood Cancer Initiative that they have been supporting for the past 20 years and donated about $120 million, which is a really huge, huge effort that they have been working on. But nobody knows about their childhood cancer campaign really well, or people don't know about what Aflac does really well. Aflac is a supplemental insurance company, and people know about their brand, the duck, a lot. But Aflac had this issues of they do this really amazing initiative in philanthropy, and how can they elevate this story so that people can know about their missions and really be more successful in sharing their stories around all the efforts they have done for childhood cancer. And they've seen the work that we have done with Jerry the Bear and came to us and say, how can you help us create this? We want to make something tangible like Jerry the Bear for kids with cancer. And what we have done is, in the past, what we have learned is even though the idea or the solution is there, we went back to a drawing board and started with the problem statement on how might we improve the lives of children with cancer. And what we have done is in the first 3 months, we have done all the research, like going to the hospital, talking to doctors, talking to families, talking to kids to best understand, what is the life that they are going through. We might have some preconceived notions on what might work for children in these chronic conditions, but we have never been in the hospital environment. This is really new to us, and also kids with cancer being a very sensitive population, so we wanted to do our research really right and make sure that anything that we come up with is rooted into actual insights from the users that we have talked to. And what we've learned is that for a typical treatment days is 1,000 days for children. And these kids, depending on their cancer conditions, they might be mainly inpatient, some might be outpatients. Their cancer treatment journey really varies. And also on the first day or a typical day in the inpatient setting, they're seeing about 80 different visits every single day. So you can imagine kids want to have some quiet moments, but they can't, maybe because their machines are beeping, there's always people checking in. It's really a lack of privacy in that case. And these kids can be as young as a couple months old to kids in their preteens or adults. So it's a really huge group of people that we are designing for. And when we are kind of doing the secondary research and talking to people, we had this big assumption where maybe educating about your cancer might be a really important thing to design for. And what we have seen is that when we made this different journey maps, so these are some of the synthesis that we do when we collect all this data to best represent this, to align our teams together quickly on the actual insights that we have gathered from people. What we have learned is that all kids, cancer treatment journey is all different. Even though you might have the same leukemia, depending on your body or the type of cancer, the location, whatever that might be, your radiation cycles or the type of treatment that you might get are all different. And that kind of broke our first hypothesis where maybe focusing so much on education might not be the way to go. let's just best understand again on what are some emotional journeys that these people go through. Is there a way that we can best understand? And we continue kind of synthesizing this insights more and using empathy maps to kind of separate those out different cues, like what people see, hear, think, and feel. And also use mind maps, like, after seeing some common emotions that we have seen, how do all those thinking and feelings group together so that we can see some core elements that we are seeing from the cancer journey that we are seeing. And lastly, we create emotional journey maps, which is to understand what are some highs and lows that these people go through from diagnosis to post-treatment. And after seeing all of these synthesis and really understanding the landscape of what children with cancer are going through, what we have learned is that even though the children's treatment journeys are different and education might be difficult, all kids need some type of emotional comfort. Kids feel isolated in those treatment journeys. Kids want to have support, but sometimes it's really difficult for them to express their emotions. So using that, we came down to the 4 design criteria where we want to focus on, which is a combination of joy. What we have seen is that hospital feels like jail for these children, so the product that they're interacting with should provide a joy to overcome that frustration that they have in those environment settings. Comfort, because cancer is very scary for children and parents. There's a lot of unknowns and uncertainties, so we wanted our product to create the kind of comfort where kids can rely on and really feel that support. Connect is kids feel disconnected and isolated. So how can we help this product to help kids connect that bonds between parents or doctors or whomever they are close with in their family or support network? And lastly, to educate. Even though we know that the type of specific treatment might be different, there are many aspects of that overall journey that kids are going through that we might be able to hint some educations into that. So after we come up with this design criteria, we started prototyping. So initially we started out with more like single function prototypes, because sometimes you might have this grand idea, but to build a grand idea first with multi-functions, it takes a long time. And you might realize before you test with children on those specific features, you might be investing too much resources and times into something that you might not realize that's the best idea to go to. So here's some products where we had a duck with a vibration, dark with different kind of lights coming up. And what we have done is we used the ducks off the shelf and hacked different toys with different functions and put it into a duck and it tested with children. And it might be a one person because it's better to have a testing anecdotes from an actual user than us testing it all the time. And we also did a lot of brainstorming. And this is some of our teammates. We had a host of ideas, on crazy ideas to not so crazy ideas, and we tried to generate as much as possible. And what we try to do is, using those syntheses that I've shared before, make sure that all of our ideas are rooted into an actual insight. And we have found that that's very helpful, because sometimes we ask ourselves, is that an assumption or is that based on actual data? Because we want to validate whether these ideas are rooted into actual insights, because that's one great way to make sure that any ideas that we come up with or any features that we come up with are actually rooted into actual anecdotes that we can tell stories. And we have found that when you create features that is based on the insights, that also helps the users to connect with the products more, because it's something that they can relate to afterwards. We also create storyboards. So before we create the product, we try to imagine scenarios, like how would this duck be used in different settings. So we'll draw out and talk about, is this what you're envisioning, to align visually on what we're designing for. And once we kind of figure out the features, before we CAD it or put into actual mechanical systems, we use foam models to figure out where the sensors might go, so that we can align in the vision of the product design first before we take it into the computers and print different sections of the product. The duck also has an app component, because what we have realized is that even though we want maybe like 80% of the interactions to be focused on the physical duck, they are that 20% of the interactions that could be enabled by the app, because we have learned that kids want to explore different worlds and we want to create that with the app environment. So what we have done is we'll create wireframes and different like interactions along the way to see when you do X, Y, and Z in the app, how would that interact with the duck? And that's another way for us to visualize on the product vision of what we are creating for. And we did a lot of rigorous testing. So in that year of creating this product, we have gone down to the hospital every other month and testing with kids from 10 to 15 kids in the hospital setting to see whether we are designing our features the right way or not. And we always run into situations where our product, the holistic system is not ready yet. So we have to do a lot of create smaller prototypes just for the testing to test our features and make sure that we are getting the insights from the kids early on and incorporate that into our bigger product. And a lot of times we'll use videos, we'll use more video-based prototypes to ask kids, like, what do you think this is happening? What do you think the duck is doing when it says quack, quack? And then get kids insights. And this is an example where we created a product feature for the duck to make calming sounds. You know, in the final product, the sound is coming from the actual duck, but we didn't have that ready yet. So what we have done is we have put a small Bluetooth speaker into the stuffed animal duck. And then Aaron, who was with me at the time, behind our actual testers, was using his phone to play different sounds for the soundscape sounds. And then for this little child who is using the app, thinks the sound is coming from the app, that he's controlling the app to play the music from the duck. So we'll do that kind of Wizard of Oz testings to kind of mimic the features that we have, but test with enough kids to make sure that we are designing that correctly. And now, of course, after we have tested with I think in that 1 year we tested with 100 family members, like children, parents, doctors. You know, we will incorporate those testing results in an ongoing basis, but also you know, put our ideas into the CAD to make our final duck that you're seeing right here. So I would love to show you how the duck works because there's a lot of features that is better to show in a demo setting. So. This is our duck. So we call this product My Special Affleck Duck, but we have seen that kids like to nickname this duck as Quacky or Quackers. Those two has been a very popular nickname. And how this duck works is that the duck has many touch sensors. So when you pet the duck's cheeks or under their wing, it's very interactive. And the skin is removable because what we have seen is that from childhood specialists especially, washability is a huge issue in the hospital. So we made sure that the duck skin is removable, easy to wash and put it back. So it's very easy to use. The duck has many accessories, and we'll love to kind of show what those features are, those accessories are, and how this work together. So what you're seeing here are different feelings cards. And how this works is that when you put the card onto the duck's chest, the duck will emote different emotions. So now the duck feels really silly. And also when the kids feel nauseous, they can make the duck feel nauseous to kind of share how they're feeling. And this is really interesting because when we were designing this, we thought the feelings card was a good idea, but we wasn't sure how the kids are going to resonate with. And as we're testing, what we have seen is that sometimes when kids are not feeling well, it's really hard to talk about their feelings to other people. But now, like using the card onto the duck becomes a conversation topic, so they can talk about their feelings easily. So we've seen that it has been a really powerful accessories or features that a lot of people have really drawn into that really broke our assumptions also. One of my favorite card is a calm card because when you use this, the duck will feel calm and will also do deep breathing. So for example, the kids can kind of follow along the deep breathing with the duck. This is my favorite card. Kids also can do medical plays. So this is the duck's port. So this is typically a port catheter that kids put it on their chest to kind of flush their lines and get the medicine directly. So when you put this port onto a duck's chest, the duck will say, I'm a little bit confused, but I think feel calm. And when you hold the duck, you actually feel the duck's heartbeat. So it vibrates. You can hear it a little bit. So this is kind of inspired by pet therapy, how that is really helpful to calm kids down. So this is a one feature that a lot of doctors and kids really like. And lastly, the soundscape card. So you can also make a duck be a sound machine. So by putting the spaceship card, you can hear the ocean or calm music or the ocean. So that when kids want to feel calm, they can use the sounds to kind of calm them down. What's really exciting is this has been a year worth of work that we have done a lot of research and testing. We launched this product at CES, Consumer Electronics Show, earlier this year, and won Best of Show for Tech for a Better World, which is really exciting. And right now, this duck is in production of 10,000 ducks right now. And starting this fall, working with AFLAC, they will be donating this duck to all children newly diagnosed with cancer for free. So we're really excited to see how this duck is going to make impact to all these children. And lastly, for Spartel, our work doesn't stop here. Our goal is to expand our work to help kids with autism, food allergies, helping the elderly and the baby market to really expand how we can best deliver comfort or create a new host of products that people can interact with to really help their health journeys. So that's what we do. And if you want to check out the duck more afterwards, please come find me. I'd love to show you the demo more in depth. So thank you so much. Yes.
10,000 units, that's like on the brink of need. I'm assuming you're manufacturing overseas, or
Yes.
are you still
We are making the ducks overseas. Yes.
Okay.
Yes.
Is there anything, like, for the first few runs that you did, were you producing in the States? Or?
So there are parts of prototypes that we have made it in-house or in Providence. What we have seen is that we are very fortunate. One of our team members that we have in our team, his name is Dan Polinek, and he used to be the director of research and development at Hasbro. And by bringing him to our team, he has helped us find really amazing partners to work with overseas who have experience working on a complex product like this, and also the standard of the quality that they're providing is really high. So it's really amazing how, even though our team here is 6 people, we have a team from AFLAC who are working with us, we have a team in productions who are working overseas, so collectively it's about a 30 people team working on this together. But I think we've been very happy working with them, and they are also, the way they do their work is they're also very passionate about helping kids with cancer too. So it's been really amazing how we share our stories. They really emphasize with us, they really know what they're solving for. And the stories I love hearing back from our teammates going to China is that they're very, very excited to work on a project that creates impact, because it's really rare for them to work on a project like this. So it's really amazing when you are connected in a mission together. It doesn't matter where you are, like they're putting hours and hours working on this. So it's been really amazing working with them. Yes.
What's the biggest gift that has come back to you?
I think the biggest gifts has been, when we go down to the hospital, it's been the amount of friendships that we make with children has been really amazing. So for example, we've been going down there for a year. We have seen 3 children who went home because they finished their chemotherapy treatments. But we met them when they just got diagnosed. But the type of stories that they share, sometimes for us, people might assume that, I can't go to the hospital, it's so stressful for me. But for these kids, for them to see us was like a really big change. It was a really big change in their day-to-day hospital life. And they really treated us like celebrities. They just wanted to engage with the prototypes. They loved being the inventors. So we had a really great time working with them. And the feelings cards, for example, is when we tested with this 3.5-year-old boy, he had this kind of interesting behaviors where he was like shaking his feet as he's thinking. So it was kind of interesting to see his movements. But when he was using the nauseous card, he will say things like, Mommy, this is how I feel when I use my Tubi. And then Mom will say, I didn't realize that. So kind of seeing the actual, interactions and people's just people giving the glimpse of how this product might work has been the biggest joy, to be honest. And I think my teammates and I cannot wait as we launch this duck in this fall to see how kids are using this. I think that will be the biggest joy. The response from the press has been really amazing. The thought leaders from the oncologist group and child specialists has been, they really thanked us for creating a product like this. But in the end, like, we really want the kids to really enjoy this product, so we can't wait to see that. So, yes.
Well, so you said 6 people on your team here. Is that
8 people in our team now.
And so just briefly, like, what are the roles of those 8 people?
Yeah. So my co-founder Aaron, he's our CEO, but his background is in robotics and user interaction design, and he's also an expert sculptor. So all the foam models and the products that you have seen is really Aaron's creation. My role as Chief Creative Officer, I oversee all the earlier phase of design research, and I do all the illustrations, some animations, art directions, and the look and feel aspect of things, and leading user testing has been all my role. Our CTO, Joel, he wears multiple hats like engineering, technology, finances, and also he leads all the clinical research, so he wears those 3 hats. Our teammate Brian, he's a software developer but also a game developer, so he also animates. So in the app-specific settings, that will be a product where Brian and I will work very closely together, create the look and feel and the interactions of the app. Dan Polonic, who I mentioned, he is our head of operations, so he will oversee all the production and making sure our office goes smoothly, but his background is also in industrial design and toy industry, so he understands every aspect of those product development. The 2 people who joined us, one person, Sam, is our game developer, so he's coming from a really big game studio, but I'm really excited to start working with him more to see what kind of background that he can bring in to improve our app development experience. And lastly, Nick is coming from Hasbro, so he's our industrial designer whom we hired. So one of the aspects that we could improve more is the renderings and the visual presentations, and more product development aspects of look and feel can really be improved, and that's something where Nick is really good at. So we're very excited to have all of these people working together. But what I really like about our team is that we are all learners. We are never satisfied with our work. We always want to learn more. So we're all very curious at the same time. So I really like that our teammates have that learning attitude, because there's so much you can learn from each other. And what I've seen is that over time, the more passionate people with really cool backgrounds working together, your product just gets better and better. So I'm really excited with our new 8-people team, what else we can create with together.
So I realize that Athletic is focused on kids with pediatric cancer. But when can we expect my special robotic furry animal of some other sort?
That's a great question, Peter. That's our hope. We with our duck over here, we had so many people coming to us saying, like, can you use this for a different condition? Can we use this for kids with autism? And there are some contractual bound that we have with Affleck, but it doesn't make us at Sprout stop in creating those. So there's a lot that we have learned features-wise and technologies that we have created working on this duck, and hopefully we will expand more. I think in the short-term interim, the more we have, if we can find other partners that we can work with, because we have learned that distribution has been the biggest challenge for us as a company. We would love to build a portfolio of working with bigger companies to really fund our company, but as a long-term vision is to have a host of more Sprout branded products that we can create with. So, other questions? Yes.
So you started with 2 and now we were 8.
Yes.
I'm wondering what kind of events or milestones or whatnot happened to know that you needed to or could kind of like an investment to bring somebody else on.
Yeah.
I mean, what sort of such a person?
Yeah, so a good example of that is when Aaron and I started, our bear didn't have any touchscreens. We thought, like, Jerry's going to be like diabetes focused, it's furry, and that's something where Aaron and I together had enough expertise to create something. But what we have learned is from our testing, kids want stories from our product. They want to resonate with the character of Jerry, not so much about the education. So from the user insights, we have realized that we need to have a software development expertise, because there's a core feature of Jerry that's missing that we can't cover between two of us. So that's one of the kind of more of like a user-based product insights that led us to hire someone. But I think what has helped us is, our company history has been kind of interesting because it's not like we had this grandiose vision and going granular. It was more like an onion, like kind of peeling at the time. So we've been kind of opportunistic on who we are hiring, but also we knew that if we bring someone who's really passionate, that we want to work with, we might be able to create something together. But that being said, we are a small startup, so we can't hire a lot of people at once. So I think overall it has been our need base. Like, do we need to have a really good operations person? Do we need to have productions expertise? Or do we need game development experience? It will hire those people very selectively. But of course, like, we always ask ourselves, is this someone that we want to bring in full time, or someone we can bring in as a contract basis? So that's always like an ongoing conversation that we have in hiring or getting a contractor, for example. So, thank you so much.
Thank you, Hannah. Well, that wraps up our Clambake for tonight. I'd love to just thank our speakers and give them a great round of applause. Ben and Hannah, thank you. Thank you, Josh and your team and Wilbury Theater Group. Thank you for hosting us. Thanks again for being here.